Mazenga.
And can you state your age bracket?
25 to 30 years.
And area of residence?
Westwood.
Okay. Which type of disease that you know your friend or relative is suffering from between malaria, HIV and AIDS, tuberculosis, that you feel you can say a few information concerning the status?
Malaria, you can't really talk of malaria because malaria is short illness. You can't be having malaria for 2 weeks or for a month. That's virtually impossible if you seek treatment early. But I could talk of HIV as it's now prevalent in these modern days. I should want to say we should now try to consider HIV is not one of the killer diseases or detrimental diseases, but it's something that you can live with if you seek treatment early. So I have a lot of relatives, not really so much, but relatives and acquaintances that I know that are suffering from such indeficiencies, not necessarily a disease, but indeficiencies.
Okay.
HIV.
Okay, so can you tell us a little bit about those who are the victims of HIV and AIDS? Did they ever seek for medication from clinics or hospitals or any other healthy sectors?
Those suffering from HIV, there is still that thinking of stigmatization that is associated with coming out in the open to say I am HIV positive. But with the recent campaigns of HIV and AIDS, people are now getting to know that HIV doesn't necessarily mean you're going to die. Having HIV is one thing and dying is another. You could go for 25 to 30 years. So some people are now seeking medication nowadays, maybe to answer your question, and they are finding, life a bit easier that way.
Okay, and also to add on that one, how is the medication and support helped their lives, to improve their lives in terms of drugs and any other treatments that they are getting from the clinics or health workers to improve their well-being, since these are people who are suffering from a pandemic? So would like to know much about how those medication is improving or is changing their lives.
Yeah, so much has been done. There is quite a mileage in terms of health care and support from community development workers and maybe social workers who advocate for HIV and AIDS campaigns. We should compliment, probably should I say, the government of Zimbabwe for trying to avail HIV and AIDS drugs, namely nevirapine and antiretroviral drugs, which are now accessible to even the least class of the society. As long as someone comes up in the open to declare his or her status, he might get assistance, and some of those drugs are being offered at no cost to try to keep the lives of those infected. So I should say, with more campaigns, we will maybe get to a situation whereby there won't be much deaths that are related to HIV and AIDS.
Okay. Furthermore, how has their lives changed since they were diagnosed by on that pandemic disease? How has their life changed up to date since they were diagnosed?
They've changed significantly, positively, significantly, very well. Why? Because someone would have put himself or herself in that, should I say, a shell which is comprising of inferiority complex, whereby someone is so much reserved. But with the advocacy of such campaigns and the assistance, someone would now discover that it's not the end of the world. And if you are to pursue your career, you can still go on to pursue your career despite having a HIV positive status. So in that respect, I'm saying if those campaigns are to be aggressively done as they are, I think we are going to have less cases of people who are going to be found suffering from stresses just because they've been diagnosed or tested positive. So we are saying thumbs up for the campaigns and the availability of drugs.
Okay, Mr. Nyazinga, I have no much to say, but to thank you for your precious time on answering my frequently questions. What are your last words that you wish to encourage or to share with the young generation out there?
With the young generations of today, my words are, please, the safest way to run away from HIV and AIDS pandemic would be to abstain. Right. If we are to mention it, there are 3 ways. The first way will be to abstain. Number 2, abstain. Number 3, abstain. But in such situations where we are dealing with people who are already involved in such sexual activities and many other, you would say people should use or indulge in protected sex, or they should get to be involved in such campaigns like circumcisions, etc, etc. And that is when someone might be infected or is not infected. But actually, when someone might be infected, it's still proper to use all those protected sex or measures that are available for us, the youth. And I would just want to say, when you get to be tested positive, it doesn't mean this is the end of your life, please. It does only mean that you have a virus in your body that is not going to kill you if you take conservative and proactive measures to try and harness the spread of that virus in your body. So in that respect, you should just stay positive if you are tested positive.